Perfect. All right. Good afternoon, everyone. Thank you so much for joining us today. My name is Steve Keller. I am the project developer and national speaker for Drug Free Kids Canada. And I'm here to introduce a wonderful resource for the parents, guardians, providers, and professionals that work with youth that are listening in today, which is our Parent Support Hub. Now, this workshop does have two sort of goals today. It's an education workshop, but it's also discussing a great resource that we have on our website, which is there specifically to provide help and support for families, for individuals involved in the lives of youth, and for youth themselves experiencing any harms associated with substance use and mental health, shall we say. Which is why we titled this presentation Here to Help. We're going to be addressing the role of stigma in the lives of youth, in the lives of people who use substances, in the lives of families, of communities, and sort of the steps we can take to address and reduce the barriers and stigmatization that can occur if someone is experiencing issues related to their mental health, particularly substance use. Now, at the start of every presentation, many of you that have seen me before have heard me speak about our vision statement. It's very important that we understand this because our vision statement itself is a step towards us working to reduce any stigma. Our goal is to ensure that young people are able to live their lives free of the problematic substance use and addiction they may face, the potential harms associated with substance use. One thing we understand at our program is that substance use is a choice. And if we were to promote abstinence only approaches, we would actually be creating judgment and barriers to individuals who may use substances. They may feel ignored, they may not feel validated, they may not feel connected with. And if our message was strictly to tell them you cannot do drugs, the ones that choose to or the ones that see others around them using may find themselves in conflict with what we talk about. So therefore, our goal is to try to reduce the risks, reduce the harms. We do speak about abstinence and choosing not to use, but again, that's the idea of choice. And for those who choose to use, what strategies can we help them with that will reduce their possibility of experiencing harms both in the short and the long term? Now, today's agenda has three parts. There's three things we're going to do. The first thing we're going to do is we are going to examine the link that we know that exists between youth mental health and substance use. We understand there's a correlation between the two, which you'll see in the next several slides. And from there, we're going to speak about what sort of barriers may exist for individuals and their families if they're seeking support for any harms or problems associated with substance use. With that in mind, the third thing that we're going to do is we're going to present and explain the role of DFK's Parent Support Hub in reducing stigma and supporting families across Canada. So you're both going to see health promotion and education in this presentation. We're going to identify an issue that we see, identify steps we can take as professionals to work to resolve this, and identify ways that our program offers supports in doing so. Now, during these presentations, anyone that's seen me before knows that I'm a big fan of live polling, of offering the audience a chance to answer some questions. So the first question I have for you, and you can toss this in the chat panel, is at what age do you believe that youth first try alcohol and tobacco? Do you believe it is age 9, age 13, or age 16? And you can put your responses in the panel there. Let me know what you think. Option A, option B. See a lot of people looking younger. Give you a few more moments. I always like giving a nice, easy one to start with because it makes sure that my audience's chat panel is working, make sure we have good connectivity. I see the majority saying around age 13. Now, the answer that we see as a national average does in fact come to around age 13. Now, with that in mind, there are some communities that report this number slightly lower. There are some that report it slightly higher. And if we look at the onset of other substances, things like cannabis, the average age of onset use is around 14. If we look at youth who may use over-the-counter medications recreationally, things like Gravol, sleeping medications, things like that to get higher, to feel impaired, they may start around 11 or 12 years old. And opioid use, we see that number can fluctuate significantly. We see reports at age 12, we see reports at age 15. But if we're looking specifically alcohol, tobacco, we'd say 13, cannabis around the same point. Other substances may vary. More research would be needed on those. Very good. Question number 2. What percentage of youth report moderate to severe symptoms of anxiety? Would you say it is 60, 20, or 45%? What do we think? Vote for 40, a lot of votes for 60. Again, a lot of people guessing on the higher end today. Survey says Our answer comes in around 45%. That's nearly half, 45%. So about, 2.5 out of five. So 5 out of 10, pretty close. 4.5 if you want to be, exact. It's hard to really measure a half a person, though. That's here and there. So we do understand that anxiety does run quite rampant, particularly through young people. In fact, I remember reading that Stats Canada had actually reported that youth anxiety disorders had increased twofold in the last 10 years. And actually, it was the overall number had increased twofold, but among youth, it had actually increased almost threefold. So we've seen a significant increase in the last decade in reported symptoms and occurrences of anxiety and anxiety disorders. Next question. How much more likely are people with a substance use disorder to report also suffering from a mental health issue? Do you think they're twice as likely, three times as likely, or equally likely? Some people saying equal, some saying three times, twice, three. I like some discrepancy here. This is good. A little bit of doubt. The answer is actually three times. We know there is a strong correlation between mental health issues and substance use. Individuals who use substance use and have issues with it are three times more likely to suffer from a mental health disorder. This connection highlights the need for an integrated support that addresses both mental health and substance use issues that a young person may face either individually or, more commonly, unfortunately, simultaneously. Now, in other presentations, we discuss substance use in more depth. We talk about prevalence, we talk about risks, we talk about harms. Today, the focus is really on identifying barriers to support. But one of the things that needs to be understood is a common reason that youth cite for substance use. We find that a significant number of young people who turn to substance use do so to manage their stress, in many cases without considering the long-term ramifications of substance use on their health and wellness. For instance, about 1 in 5 people who live with anxiety report using alcohol to cope with stress. About 1 in 5 youth in grades 7 to 12 in Canada who report vaping say they do so to relax or relieve tension. About half of youth between the ages of 16 to 24 that report using cannabis for any medical reason say they do so to treat anxiety or depression. And finally, about 1 in 8 post-secondary age youth who use pain relievers non-medically do so to cope with stress. So we know that stress and anxiety is unfortunately a common underlying risk factor for not only substance use, but harmful or problematic substance use. And what can compound that stress, and we talk in greater depth about stress in another presentation, but one thing that I do want to address today is that stress can be compounded by a feeling of loneliness or a feeling of no one really having your back and a lack of support. And that brings me to my next point. If we look at the barriers that youth face to accessing mental health and substance use services, if we know there is a prevalence, a significant prevalence of youth that use substances, why are they not calling for help? When those things are needed, when those supports are needed, seeking support is not always easy. And according to the CIHI, or the Canadian Institute for Health Indicators in Ontario, there is a real and perceived barrier to getting help. According to the CIHI, the top 5 barriers to accessing mental health and substance use services are timing, long wait times. I've worked with regions that have spoken about counseling services facing an 18-month to a 24 to even a 30-month wait list for individuals. Feelings of being overwhelmed or uncomfortable, the limited choices that may exist in their region or that they feel are available, may even be a lack of familiarity with those. The other two come back to fear. It's the fear of what others think and the fear of being misunderstood or being dismissed. Now, before I define and really explain what stigma is, I keep bringing up that message and that word over and over again. I want to ask you, of these top 5 barriers that you see in accessing mental health services, which of these do you believe are affected or impacted by the idea of stigmatization? And if you don't know what stigma is, that's okay, because I'm going to answer this later. Maybe you have an answer now, maybe you don't. But in how many of these barriers do you believe stigma plays a role? What do we think? 2 or 3? All of them? All? 2? We're going to come back to this in a moment. I'm going to come back to this idea a little bit. But I do also want to note while we're here That while all five of them are impacted by stigma, it is not only the youth themselves who face this idea of barriers or lack of feeling of support. It's also worth noting that the Mental Health Commission of Canada has reported that 40% of parents wouldn't actually tell anyone if their child was experiencing a mental health issue. So it's not only that youth themselves may not be seeking help, but if a family member, if a trusted individual sees that in them, in 40% of cases, parents aren't actually accessing supports. They're not calling for help. They don't want to talk about it. Now, why is that? In order to understand that, we have to understand the term of stigma. And I keep bringing it up. I keep saying the word over and over. And if I'm going to, I need to give it an operational definition. The Latin and Greek word stigma originally referred to like a burn or a tattoo or some other mark that was applied to someone else to symbolize shame. It was identified to slaves, to traitors, to lesser individuals in a community. However, in modern times, stigma entails more of prejudice or stereotyping and labeling, and more on that in a moment. It's the negative attitudes and behaviors and beliefs about a certain aspect of an individual or of a group or of a community. And the notion of stigmatization can cause people to fear others, to reject them, to misjudge and or discriminate. So what this infers is that at any given moment in which your language or attitudes or beliefs are centered, either directly, intentionally, or indirectly and unintentionally, around treating an individual less than based on their circumstances or identity, at that moment is where we see stigmatization occur. So it's important to understand that every single one of us contribute to stigma, either in that we feel it, we see it around us, or we contribute to it in others. And we'll talk about how that happens here. How does stigmatization actually happen? How does stigma occur? I gave a very simple explanation, but we can get into it a little bit more deeply here. We throw this word around at times without really explaining it. And more importantly, we don't always understand how it happens. We talk about ending stigma, stopping stigma. Well, people don't understand how it occurs and what the sort of cycle is that creates this sort of discrimination or these feelings of judgment or hurt or negativity. If we can't understand that process, we can't actually address it. So what we're going to do is we're going to apply this to an individual who uses substances. I'm going to start by asking you a question. If you were to hear a term that identifies an individual that consumes alcohol, and I'll say problematically consume, what is the term that they're often referred to as? A person that drinks alcohol regularly, that drinks alcohol to the point of experiencing harm. What sort of titles do you think they hear? We hear alcoholic, right? What else? We hear alcoholic. I've heard drunk. Um, what about someone that uses cannabis? We hear drunk, we hear drunk, alcoholic. What about cannabis? What do we hear then? Lush, a pothead, we hear stoner. Those titles are actually the beginning of a process of stigmatization. And what this is that process is labeling. So the first thing that happens in stigmatization is we know there's something different. So what we do is we put a label on it. We try to identify an individual by their characteristic. And what we've actually done is dehumanize them in the process. Someone who drinks alcohol versus an alcoholic are two different titles. More on that later. So we talked about the idea of someone that drinks labeled as a drunk, a person that uses cocaine maybe labeled as a cokehead or a junkie, someone using cannabis could be a pothead, a person using drugs in general being called an addict or a druggie. Now, here's my second question for you. If you heard someone referred to as an alcoholic, would you let them drive your car on a Saturday night? And you don't have to answer this if you're not comfortable answering. But this is a complicated question. I used to work in gambling a number of years ago. And one of the questions that we would often discuss in stigmatization when it came to gambling was if you knew someone had a problem with gambling, would you lend them money? So if you knew someone had an issue with drinking, would you give them your keys? Why not? I hear people say probably not. No, no, no. Why not? This leads to the second aspect of stigmatization. Once we see labeling, we see what's called stereotyping. Because once a label exists, we have to explain what that stereotype means. So when you hear the word alcoholic, what do you think of? What words come to mind when you think of alcoholic? Irresponsible. Okay. no control, uncontrollable, unreliable, excessive. So what that is that's where stereotyping happens. We have a label, but we have to understand what that label means. And again, like I said a moment ago, an alcoholic is different in our minds than a person that drinks alcohol. Again, we'll talk about why later. Now, the third thing that happens when a label is created and negative stereotypes are associated, how are people likely to react if they knew someone was an alcoholic and felt they were untrustworthy, unreliable, or excessive? What kind of emotional reactions do you think would be elicited? Negatively. Absolutely. Here we have that point that the individual is less likely to trust them. They're less likely to want to speak with them. They're more likely to ignore them. And in some cases, they may be even more likely to harass or insult them based on various circumstances. And at the final stage of stigmatization, we see discrimination. This is an extension of that negative reaction. Once the person is labeled, once the person is stereotyped, and once they're seen in a negative light, it becomes more likely that they will be discriminated against. If an individual who has an issue with alcohol is seen as untrustworthy, they may not be asked to drive. They may not be asked to pick someone up. And at that point, well, why not? Well, because I don't trust you. Now we have a negative reaction being created there. And at that point, people may begin to make fun of them, to speak down to them, say, well, I don't want to drive with you. We have to travel. I don't want you to drive. Because what we've done is we've created discrimination based on a label. Okay. These feelings, not only when they're pushed out on the individual, they then become internalized. This leads the person who uses substances to feel negatively about themselves. It also causes them to lessen their sense of self worth, and it decreases the chances that they're going to talk about that with someone else. Yeah. Okay. Now, the government of Canada identifies three different types of stigma. It occurs at multiple levels. So when we consider the stigma that surrounds substance use, we're going to focus on those three particular types of stigma. The first one is called self-stigma. This impacts how a person feels about themselves. It's when someone internalizes the negative things that they hear, in this case, but substance use, which can exacerbate or increase their own use. So they've heard that someone that smokes pot is lazy or they're immature or they're irresponsible. Someone that drinks alcohol is untrustworthy and you can't leave them alone. They begin to internalize those feelings, even if they're not true about them. They may begin to act that way because they believe that's how they're perceived to be. But what they're also more likely to do is feel uncomfortable talking about it. So consider a person that smokes tobacco at times when they feel stressed or overwhelmed. We talked earlier about substance use as a coping mechanism. And then they hear that smoking is unhealthy, it's dirty, or it's irresponsible. That message obviously will come across as being offensive and being labeled in a negative way. And if I'm labeled as dirty or undesirable or unhealthy or irresponsible because I smoke tobacco, do you really think that's going to reduce my stress? We think it's helpful to point these things out to people, but is it always helpful? Or do you think it's going to compound my stress? And furthermore, if it compounds my stress and increases my stress, what am I going to do to manage my stress? I'm going to use more. Social stigma. Social stigma describes the negative attitudes and treatment towards a person who uses substances. So, Johns Hopkins University reports that stigma is rooted in this belief that addiction is a personal choice. It reflects a lack of willpower or moral failing. That's the stigmatization around substance use. That if you have an addiction to drugs, you chose to be that way. Someone may believe that a person's substance use is an immoral or a bad choice. And this mentality can cause them to think less of the person for using drugs. Even if they're not talking about drugs, they begin to treat them differently. They look down on them. They condescend to them. They treat them like they're irresponsible, even when it's not about drug use. So we see these negative attitudes and judgments being cast down on someone when they're using a substance. And again, stigmatization can happen across the field of other attitudes or beliefs. Today, we're just focusing on substance use. Finally, we see structural stigma. This is when policies or rules work against an individual's recovery or the overall wellness of a community. Examples of this include excessive wait times for inpatient services. You have a community that, say, reports a significant rate of opioid use or a significant rate of harms associated with methamphetamine, but we lack the services and treatments that are available to help those individuals. And when they can't seek help, when they can't receive support, and if they don't know that they're more likely to continue using a substance in that situation. There's nothing to help deter that behavior. So that structure itself acts as a barrier. Another example is cutting funding or closing centers that offer treatments. Another example of structural stigma is the criminalization of all aspects of substance use, as well as negatively depicting substance use in media. It's where the things that sort of exist beyond our community work in such a way that they create substance use as a moral failing. So it's not just that our friends treat us a certain way, or our partner, or our loved ones, or our peers. It's now the whole world that we see around us, the TV that we see, the media we consume online, the policies that are passed in a region. They begin to get structured in such a way that we can't actually seek support. Now, there are additional aspects to stigma that need to be understood. First one is secondary stigma. This is stereotyping or judgment that's experienced by people involved in the life of a person that uses substances. This is really an expansion of social stigma. So, if someone, for instance, is a frontline care provider offering support for people struggling with addiction or substance use related harms, these people may be stigmatized for their decision to help others. Why would you help that person? They're a bad person. That makes them bad by it's like guilt by association. Another example is assuming that friends of a person who uses drugs also use drugs. This can happen when we express concern about, a young person who has a friend that we know smokes weed. We may assume that that young person is going to smoke weed because their friend does too. They're not defined by other people. They're defined by their own choices. The third example is avoiding someone's family because that person's use of substances. So again, if someone, say, has an issue with alcohol, then it may be that their family, their relatives, their kids may be avoided or not invited out to events for some perceived fear or belief that, well, they're just going to drink because their father drinks, their mother drinks, their partner drinks, their child drinks. The second is health practitioner stigma. And what this is when a healthcare provider's beliefs can actually get in the way of their ability to provide care. An example of this could be a youth support worker that has a negative experience with substance use. Perhaps something has happened in their life that was traumatic or harmful related to substance use, and that has painted their values to lead them to think negatively about all substance use. They feel that way. I'm not going to change how they feel. But what we understand is that that may cause them to treat a youth or a client differently than others if they find out that youth uses. They've seen harms associated with tobacco, and now their client's starting to smoke. They may start to treat them differently because their values have taught them that smoking is harmful, but they perceive it as being bad, and now they hang that on the individual. The third is perceived stigma. This is a belief that others have negative beliefs about a person for using substances, even if they don't see them. This is sort of an extension of self stigma. An example of this could be when a person sees a negative stereotyping online of someone smoking weed. And as a result of those depictions, it reflects on their own personality or qualities or characteristics, even if that's not true. The last one that we're going to talk about is called label avoidance. This is when a person that uses substances either denies use or admitting that they may have a problem with substance use, and they may go out of their way to avoid others who use the same substance as well because they don't want to be judged for using. They don't want to be judged for being associated with that group of people. Label avoidance can be very harmful and it can also be very dangerous. And here's why. If a person has an issue with, say, fentanyl, that they're consuming opioids, and they're trying to avoid that title of someone that uses, they don't want to be called an addict. They don't want to be labeled as a junkie. They don't want to be labeled as whatever they see in stigmatization. When they're avoiding others and they're still using, they're not using on their own. And that's one of the greatest risks we see with overdose and fatality with fentanyl is that a person overconsumes, they pass out, they stop breathing due to opioids' effects on the brain. But because they've hidden it from everyone else, there's no one around that knows that they're using. Because they want to avoid that judgment, they don't let anyone see them using. They're more likely to be harmed, they're more likely to overdose, they're more likely to unfortunately pass away. Which of the following statements describes the impact of stigma on a person using substances? Is it that a person who uses may avoid seeking help because they don't want to be judged? Is it someone that uses substances might struggle to find housing and employment? Is it that substance use affects the quality of care a person receives? Or is it that someone who uses substances may hide their substance use or use only when they're alone? You guys are right on the ball today. The answer is, unfortunately, all of the above. Every single one of these statements is true. And the government of Canada have actually outlined ways in which an individual can be affected by stigma. They actually created a list to show this as stigma because not only does it cause discrimination, but it restricts individuals from seeking help. So again, people that use drugs, especially those struggling with addiction, face discrimination and barriers. So the more they use, the less likely they are to seek support for a various amount of reasons. So how do we reduce that? Well, if we review this cycle of stigmatization that we see, we need to sort of disrupt the cycle, take a step or two out of this process in order to kind of reduce the efficacy of this cycle. So any action to lessen stigma must be part of any strategy to address the overall substance issues that we see. If we wanted to identify overdose related problems, the overdose crisis that we see in Canada, we have to take steps to lessen stigma. If we want to reduce impaired driving numbers in Canada, we have to reduce stigma. If we want to reduce the harmful outcomes long term of tobacco use, we have to work to reduce stigma. It's not about creating judgment, it's about creating dialogue. Stigma free, judgment free dialogue. Now, how do we do that? Let's take a look at labeling. Identifying an individual as a label separates them from their characteristic. So the list we have on the left, and we said some of these earlier: addict, junkie, users, drug abusers, substance abusers, recreational drug users, drunk, stoner, cokehead, smoker, etc. What is the relationship between the individual and their drug use in these labels? What do you think? What is the relationship between them? They're unified. You identify the individual as the substance. So if you identify an alcoholic, you're identifying alcohol as part of who they are. It becomes their personality. A cokehead, they become cocaine in their mind. You've taken away their humanity and identified them by the drug they use. So what is some language you can use instead? A person that uses, people who use drugs, people with an addiction or a substance use disorder. Even the word addiction carries stigma. So you'll notice more and more providers move away from the word addiction and move towards like risky use or problematic use or disordered use, because the word addiction itself carries judgment. People with lived or living experience and people who occasionally use drugs. All of these statements are called person first language. What you've done is you've identified that the individual exists separate from the substance that they're using. Why does that matter? Well, it's because when you use these sort of terms, you're creating a neutral statement. You're identifying the person as here, their substance use is over here. It helps to separate them and create a safer environment that they feel that you see them as a person. I see you as a client. I see you as a partner. I see you as a student. And what you are is you're showing them that I don't just see you as someone that uses drugs. I see you as a person, and substance use is there, but I still identify who you are. Second, well, how do we avoid stereotyping? Well, beginning with avoiding labeling, that can reduce the presence of stereotyping. But there are other steps that we can do to help reduce this issue. If we take away the label of alcoholic, if we take away the label of stoner, the first thing we have to do is stay educated. We keep up on the trends in substance use, the reasons a youth may use or not use drugs, and understand how they affect the body. Because that's important to understand how difficult it can be for a person to stop using or to understand what it is that they're going through. In many situations, we never will. We'll never fully understand what someone else is going through, but we can offer support. And the way that we do that is by learning how substances affect our body, while at the same time learning more about the person, which leads me to my second point. Instead of assuming that a behavior like substance use automatically means a person is untrustworthy, check in with them and get to know them better. What if someone drinks alcohol, has experienced harms related to alcohol, but never drinks on days they know they drive? Does that necessarily mean they're untrustworthy? Not necessarily. If someone has an issue with tobacco, but say that they smoke only away from a building, they smoke only in designated areas, they don't smoke around people who are non smoking, does that mean that they're selfish and irresponsible? They're taking time to think about other people there. They're adhering to social policies and they're keeping their secondhand smoke, which can be harmful, away from non smokers. Does that make them selfish? You want to offer empathy. If a person's using drugs, especially if they're talking about it, it doesn't always help to just say, I get it. Like I said a moment ago, we can't totally understand a person's situation because they change. If someone shares that they're using drugs, especially if it's causing them harm, it's important to show compassion and invite them to tell you anything they want to talk about so that they can show you how they're feeling, as opposed to just assuming that you know what to do in their situation. And finally, you encourage diversity. Everybody's different. Stereotypes often come from our response to the things that we don't understand. So, encouraging people to share aspects of who they are can help foster a greater sense of understanding and increase our awareness of others' interests, values, cultures, beliefs, and experiences. What about emotional reactions? Well, we need to consider how we react in situations. Again, first part's avoid stereotyping, but it segues into the second part. Consider our own biases. If we're a provider, and we're working with someone that's struggling with alcohol, and say our partner was killed by someone who's driving under the influence, or we had a family member that died as a result of alcohol related harms, that may create an unknown bias in ourselves that we act differently towards a client because they're using. Everyone is different, and we have to be aware of our own feelings before we integrate with somebody else, before we connect with somebody else. And how do we do that? Well, we consider, how do our reactions affect others? If someone's talking with me about substance use and I find myself getting upset about that, I have to ask, why is that happening? Where's that emotion coming from? What experiences in our own lives have shaped our values or feelings towards substance use? And you'll even notice that as I go through a presentation, I start shifting more away from the word drug and more to the word substance, because we know the word substance itself is more neutral than the term drug. Now, finally, what can we do to counteract discrimination? We create safe spaces. As adults, we play an active role in fostering protective factors for young people. So if you're a parent, we celebrate the healthy choices that our kids have. Periods like back to school, exam season, those can create a lot of stress. So asking youth what they're doing to manage stress, if they're taking walks, if they're exercising, if they're spending time with friends, if they're doing things they enjoy, we celebrate those. If they want to get out and do something as a family, that's important because that creates a safe space. You help your child take part in their interests, stay connected, and support them no matter what. And of course, store any medications and substances in a secure manner out of reach of children. That does have to come up in these conversations. How do we do as providers? We promote sports teams, we promote school clubs, we promote intramurals, after school programming, youth events, because it creates community. We promote expectations that are attainable and that are equitable. We avoid favoritism. It's one thing to have a positive relationship with certain clients to I'll say a stronger degree than others. There are some people that you will build rapport with, but that doesn't mean you can change your expectations for everyone based on how you feel about them. Your expectations need to be the same regardless of who you work with. For the agencies that work here today, many of you already do this and I applaud it, but it is important that you share your resources to increase the awareness of the multitude of services in your community. If you can't help a client, you need to know who else can. That doesn't mean you're going to lose the client. What you're actually going to do is build trust with them because they'll trust that you didn't know something, but you knew who did. So when they need the service that you have, they're going to be more likely to call you because they saw that you swallowed your pride instead of saying, oh, well, I'll make something for you. No, instead, I'm going to get you where you need to go. And finally, encourage and promote unused drug drop off and return to local pharmacies. Again, this is just a way to help keep substances out of the reach of young people, out of the reach of those who may not benefit from them, and certainly out of the reach of those that can be harmed. Now, the very last thing in this presentation is to understand the role that we have as our own program. I've talked about what can we do as partners, what can we do as parents, as professionals that work with youth. But I also said that one of the things that I wanted to show you today is how we help here at DFK. And here's how we can help. It's through what is known as our Parent Support Hub. As I mentioned earlier, the stigma exists as a major barrier to seeking help. About 40% of parents say they wouldn't tell anyone if their child was experiencing a mental health problem. So our Parent Support Hub, which you can find on our website, drugfreekidscanada.org, what it does is it offers a confidential and non-judgmental space for parents and guardians to get the support that they need, helping to reduce feelings of shame and, more importantly, reducing those feelings in isolation. Look, we know there's a significant gap in the access to mental health and addiction services. With this understanding, we developed the Parent Support Hub to help bridge that gap by offering 24/7 support that is free, it's immediate, and it's professional. So the Parent Support Hub, like I said, 24/7, is a online and phone support service that assists parents, guardians, and families concerned about the substance use of a young person in their life. It is available any time of day. It is free. There is no cost involved, which ensures accessibility. The support is confidential. The interactions are private and they are secure, ensuring that your information remains protected. When you connect with the Parent Support Hub, you speak directly with knowledgeable care representatives and mental health and substance use counselors who can provide immediate support and guidance. And it is powered by TELUS Health, which is the service provider here in the country. Just giving a moment here before I move on to the next one. Why do people access it? Why do we encourage you to access it? Well, we know there's an importance in accessing support. Youth ages 15 to 24 are more likely to experience both mental illness and or substance use disorders than any other age group. Furthermore, the majority of individuals who are adults that struggle with addiction began issues with substance use during their adolescence. Individuals affected by mental health issues are more likely to have experienced them starting earlier on in life. So we understand that early intervention matters. It is crucial to prevent the escalation of mental health and substance use. Now, again, that's not always easy to get, which is why the hub is there to give answers and tools to help families understand and work to understand what a youth is going through and why they may have started using. What are they being affected by? So, we work to reduce the risk of problematic substance use. We create supportive environments and offer proper guidance that can significantly reduce the risk of harmful substance use among youth. And again, the hub is available to all Canadians in English et en français. What are the benefits of early intervention? Well, Parent Support Hub ensures support is always within reach. Early intervention can prevent a young person's substance use from escalating into problematic use. And timely intervention can lead to better mental health and substance use outcomes for youth. So therefore, when we build a network of support, this helps families navigate these challenges more effectively when they arise. We understand that seeking help is a sign of strength and proactive parenting. So this hub offers you empowerment. It offers you a support network. It helps you to understand the network of resources and providers that are available to help navigate the challenges that we face. So how does it work? Well, step one is by reaching out to the number at 1-866-381-1511, and we'll have another slide that shows this again. Or online chat. Again, you can find the Parent Support Hub at drugfreekidscanada.org. Available 24/7. I know I've said that a few times. It just pops up a lot. Step two, begin the chat. You receive immediate assessment and guidance, including tips for handling substance use and mental health issues. TELUS healthcare representatives respond to the call or chat once it's open, no matter what time of day. They will ask the caller's personal information only to ensure that a confidential file can be created and followed up on. This way, if they have a client call multiple times or they want to connect back with them, they just have access and means to do that. So they're not asking you the same things more than once. Once the file is created, they will then assess the situation and provide immediate advice as well as links to helpful resources if that is what required. They will also help access professional counseling services, which offer up to 5 free counseling sessions, often with very little or no wait list whatsoever. These scheduled sessions provide structured counseling support. And again, they offer follow-up for ongoing support, like I said, for up to 5 free sessions to provide care and guidance. It provides support. It's real people. It's care representatives trained to answer your initial inquiries. They can provide support and guidance for parents and can connect and guide parents and providers to resources and professional counseling when required. The counselors themselves are licensed mental health professionals with specialization in substance use and mental health counseling. They can offer short term individual counseling, as well as sessions for parents, youth with the parents' permission, and for parents with the child. They're experienced in working with families, and they develop effective strategies to provide both emotional and educational support. Now, I've spoken about privacy a little bit. It's very important that we understand this. The Parent Support Hub is powered by TELUS Health, but it ensures your confidentiality and personal security. Your personal file is created to ensure user security, and it is stored securely uh, and following confidentiality and personal data. Like I said, in strict compliance with national privacy laws as well as regulation. And you can find a full privacy policy page right on our website if you want to learn more. The communication itself, like I said, is confidential and it is protected under privacy laws here in Canada. If you need help, it's easy to access. How do you do it? We can call 1-866-381-1511. You can access the live chat, clicking on the live chat now button that you see on our website, drugfreekidscanada.org, and clicking on the Parent Support Hub link, which again, like I said, you can find on the web, drugfreekidscanada.org. And here you can provide a brief overview of your concerns during the initial consultation and receive immediate guidance and or access to a professional counselor you can speak with directly. They'll help you schedule additional sessions, and they're going to be convenient for you. They're going to try to book around your availability. So utilize ongoing support resources as needed, and you'll have follow-up consultations to ensure that you're receiving the continuous assistance that you need. Look, we know the ability to access support is crucial, and we understand how hard it is to do that. They're strained, they're overtaxed. That's why the Parent Support Hub is here. It is there to help provide an increase in support to support with intervention and better mental health outcomes for youth. We're grateful. We're very grateful to be able to provide this service in support and partnership with TELUS to families across Canada. Throwing a lot of information at you here in these last few slides. So before I move on to the next slide, I just want to ask if you had any questions about the hub, anything you want to know about it. And if you do have any other questions, you can also get in touch with us. You can contact our intake at drugfreekidscanada.org. Susan, would you be able to put the link for our email there if people do have questions they want to follow up on? While she does that, the very last thing I want to do, I have 2 slides left. The first is a thank you slide for joining us today. To allow you to know that you can access Parent Support Hub. I even threw a QR code up on the screen that you can check it out if you want. And the second thing that I wanted to make sure that I did was take any questions, comments that you have, and provide a second QR code to fill out our post-workshop survey. If any of you have any questions, I'm also going to put a link to the survey that you can fill out online, right here in the chat panel. Please take a moment, fill this out. It's very, very helpful for us to make sure that we covered anything that you need. You can point out anything you liked, anything you want to learn more about. And yeah, if you have any questions for me about anything you saw today, you can also email me anytime. I'll toss my email on there, Keller at, this one. The first one, for some reason, had a period there, and it shouldn't. But otherwise, I want to thank you all for joining today. We certainly hope that you enjoy the rest of your day. And if you need anything else, please feel free to reach out at any time. Thank you, everybody. Miigwech. Thank you.